When patients see me, I hope their expectations are high, and I hope that when they leave after visiting me that they feel educated about the condition they have. They feel like they've had all their questions answered about how a procedure or a surgery might go for them, and what they can expect in terms of recovery. And I really want to know what worries them. So if they're worried about things, I want to make sure that we can cover those details, get through the concerning part of the procedure so that they'll feel good about their choice going into whatever operation we're planning. I trained in general surgery at the University of Minnesota, and I did a 7-year residency. Two of those years were actually spent in research, researching issues that relate to vascular surgery. After my surgery residency, I did a fellowship at the University of Chicago, and that fellowship was in vascular and endovascular surgery. Fellowship training brings to patients an area of focus and interest from the part of the surgeon in a particular disease process. And it's a big world, but we, as vascular surgeons, are really just focused on issues that relate to blood vessels. In the old days, many things that we could offer to patients involved major operations and long hospitalizations. Over the past, particularly 10 years, we've really moved away from major operations whenever we can. And so if we can offer a patient something that can be done as an outpatient, we're happy to do that. My approach to healthcare, my approach to patients is, again, really education. If a patient is well educated going into it, they will feel good about their decision. They'll know what they can do to help themselves through a procedure. Sometimes we don't do procedures. Sometimes we're just talking about how we can prevent something from becoming a bigger issue down the road. And again, that's where education comes in. So if a patient is active and engaged and wants to know what they can do to make things better, that's one of the best things that we can do during a visit, is get that education down so that they're fully aware and engaged in their condition. But I really enjoy meeting up with patients that I have worked on maybe several years previous, and we bump into each other in a grocery store, and they're doing well, and that's very gratifying to me, is to see a patient who's happy with the result of their surgery and active and living a busy and healthy lifestyle.